Joining me now is Dr. Basima Williams. How you doing, Doc?
I'm doing great. Thank you so much for having me today, Brandon. How are you doing?
I'm great. Thank you for being on. Hey, let's talk about Hulk Hogan. Died last week of, a cardiovascular issue, I guess, a heart attack.
Yeah.
71. This has been all in the news. What are your thoughts? I mean, I guess you don't see it. You don't know his medical history or records, but overall, people dying, a sudden, unexpected death, heart attack. What are your thoughts about this?
Yeah, my thoughts are that over 365,000 events happen out of the hospital. Cardiovascular cardiac arrest happens out of the hospital every year. And of those cases, 365,000, 90% mortality rate. That means you have a 9 out of 10 chance of dying if you have an event at home. So the most important thing that I wanted to talk about today, and I'm glad you're bringing this up, and just all condolences to Hulk Hogan and family. He's pretty active. I was kind of shocked. I actually, when I looked it up to see why he died, I wasn't expecting that given the recent convention and how strong and powerful he looked. Certainly wasn't expecting to hear that he died. So when I looked and read, and again, I'm not his doctor, I'm not anyone's doctor. This is all just information, by the way. So I have no personal connection to Hulk Hogan, but what we found is that he had a cardiac event. So more than likely a heart attack. We call that a myocardial infarction, where there's not enough oxygen going to the heart tissue due to a blockage of an artery because of extensive plaquing. And so what we want to talk about today, and just kind of talk over a couple cases, is some of the warning symptoms that you might be having, because I feel like ever since COVID, Brandon, doctors have gotten a bad rap of being sort of these villains almost because of COVID and the COVID vaccine. But what I want to be clear on is that, obviously we're not villains. We really want to help, but unfortunately, some of the information, the mainstream information that we're being taught, that is perpetuating what we do, obviously. So if we're being told that the COVID vaccine is great and it's life-changing, then we're going to want to give it, unless you think outside of the box and do the research yourself, like I have with just about everything, hormone replacement therapy, COVID vaccine, whatever it is. But with cardiovascular events, if you're having chest pain, pressure, shortness of breath, and especially chest pain with exertion, that means you're walking on a beach like my sister was for 3 weeks, walked on the beaches of Florida and was short of breath every day, and finally went home to San Diego. And she just thought it was the weather. When she got home to San Diego and the weather was better, she called and asked, what should I do? And we immediately sent her to the hospital, and she unfortunately had pretty extensive blockage of a couple arteries that they had to do surgery on. So you cannot ignore the chest pain, pressure, shortness of breath, and pain going into the left side of the jaw, or the jaw in general, but left side and left arm. And also some non-specific symptoms like nausea, vomiting, indigestion, lightheadedness, dizziness, ringing in the ears, heart palpitations, things like that. Interestingly, one sign of heart disease is if you have a lot of wrinkles on your earlobe.
Wait a minute. What? What was that last one?
Wrinkles in your earlobe. So if you have a lot of wrinkles in your earlobe, that's a sign of coronary artery disease. So that's
Logan, can you come out here? Can you come out here? How do my earlobes look, Logan?
I can't tell, so I would tell you, but I can't tell. But yeah, if they're wrinkly. So that's one place you don't want wrinkles. But here's the problem. Here's a statistic. We're talking about all these symptoms, right? Chest pain, like a brick sitting on your chest. And obviously, there's a lot of other symptoms. But like if you get this chest pressure on your chest, and especially it gets worse, like this one doctor I know who was having chest pain and got down on the ground and did 10 push-ups, and yep, it got worse. So he went to the ER because, he did his own little stress test at home, right? He exerted himself and it got worse. And so he went to the ER. But unfortunately, the reason I really, really, really want to bring this up today is 50% of people present with their first actual event, not with chest pain or pressure. And we're missing way too many of these, which means insofar as cardiovascular disease is concerned, you have to be your number one advocate, and you have to know what your risk factors are.
What about, I think I sent you a video where one guy is talking about patients exhibit signs, and one of the common signs they exhibit before they die, and then they end up dead, is ringing in the ears and fatigue.
Yes, I think that was a really good video. And I think that video was mostly focusing on nitric oxide production and how it naturally decreases as we get older. And the problem with that is if you don't have a lot of nitric oxide, then you don't have a lot of vasodilation of blood vessels. You have more vasoconstriction, which if you have some plaque here, now you have even less room for the blood to flow. So there's a lot of things you can do to naturally increase your nitric oxide production, primarily beets, eating beet or beet juice, or even there's so many.
That's what he said. He was saying, you need to get on this, and this can solve the problem. So you agree with that?
Oh yeah, 100%. But and then we have supplements like that maximize your nitric oxide production. The problem is, a little bit is good, too much is not good. The problem is it can lower your blood pressure. So you do have to be careful. So I don't mind adding, for me personally, I do juice a little bit of beets, and I juice the stems of the beets, which have less sugar in them, along with other vegetables. I think that's a really good thing to do.
I
And there's
love
also
beets. I might shock you that I love beets, but they have to be cooked.
That's fine.
She'll steam them in a little. She'll steam them in a little pan. My wife will slice them up,
that's awesome.
and I love beets.
I do too. You just have to watch your blood sugar when you eat them because they are a root vegetable, so they are very starchy.
Are they going to make my blood pressure go up or down?
They should make your blood pressure go down because it increases your natural nitric oxide production in your body. Because
so how often should I be eating beets? Let's say.
You can eat them every day. You can eat one or two little beets. If they're the little guys, you can eat one or two of them.
But if I was wanting to do the health benefits, and my wife said, we'll just add beets to the menu for dinner one night a week, is that enough?
No, do it every day. You want to add the L-arginine rich foods.
Okay, so what if she doesn't want to cook beets every day? Do you have something for us?
So we do have supplements for cardiovascular, which include nitric oxide production. However, we do not have them on My Vitamin because if we are going to use them, we really, really want to educate patients. So that wasn't part of today's plan necessarily, but it's definitely something that's in the works in terms of how to do it in a safe way. Listen, Brandon, I'm sure and a lot of your viewers, they have really been supporting you and this company in terms of just using these supplements. But I'll tell you what, people don't like to stop these supplements, not because they've become addicted to them, because they can actually feel them working. And our supplements are professional grade. So when we have a nitric oxide supplement, it's going to affect you. And so we want to make sure that we're doing it in a safe way where it won't make people's blood pressure drop down too low. But it's a great supplement to use primarily for blood pressure regulation and for pre-workout. So you take it pre-workout and actually increases the amount of blood flow to the muscles, and it gives you a little bit more capacity for endurance.
Okay. So, okay. Now, let
me just say this, that's to come. I've struggled a lot with the cardiovascular supplements in our line because I don't know what I want to necessarily give people access to, because we just have to be careful with that.
Okay.
Because ours are some.
So if people are, manifesting these signs that could be a heart attack, take it seriously.
If you're having these symptoms, go to the ER. And 50% of people will not have these symptoms. They'll just have an event. That's the problem. And primarily because some of these symptoms, nausea, vomiting, dizziness, are non-specific. So here's what you want to pay attention to. What you want to pay attention to is assess your natural risk. And how you do that is you do something called a cardiovascular risk assessment. So number one is family history. If you have anyone in your family who's had a heart attack before the age of 65, then that's a positive family history. And that's probably one of the biggest predictors. So you want to kind of listen up and take this more seriously. One of my friends had who was 45, super healthy eater, super healthy, worked out all the time, did a lot of heart rate variability work, actually nationally, so really well known for this. His brother at age 45 had a heart attack. And so he decided, well, even though his cholesterol looks good, and by the way, their dad had a heart attack around in his 50s. Oh, wow. So even though he was a healthy eater, cholesterol was great, he decided to go get something called a CT angiogram, which found him to have a 50% blocked artery in the heart that is called the widowmaker. That means that one, have you heard of the
Oh,
widowmaker?
yes, absolutely.
50% blocked in a 40-something-year-old male who lived the right lifestyle, took the right supplements, ate the right food, exercised, did heart rate variability, very mellow personality, but it's family history,
Did he
unfortunately.
survive?
Well, he didn't have a heart attack because he did a test to show that he had plaque. And so then he had to do even more than what he was doing before, which unfortunately in his case, and there are cases where you have to take a statin drug sometimes. Now, we're not anti-medicine, but man, we are picky about what we use. So like in our lab, what we'll do is we'll test to see if you're a high producer or a high absorber of cholesterol. And if you're a high producer, then maybe a little statin drug, which I do like better than red yeast rice. Red yeast rice is very unregulated, and I've seen a lot of bad things happen with that, and that's a natural statin. It still works like a statin drug works. But if you use a statin properly at the very lowest dose, and maybe every 3 days or every other day or whatever it is to reach your goals, then you can safely do it. But then also, if you're using a statin drug, by the way, if you have a family history and you're scared about your cholesterol and you already have plaque, there are a lot of good, legitimate long-term studies, multiple, that show that statins can actually work when you use them properly. So for example, I will never prescribe a statin drug without putting you on high-dose CoQ10, because when you take statins, you will also block natural production of CoQ10, and then you get the muscle aches and pains and brain fog and all this other crap that comes along with a statin. The other thing I do, you will be shocked to know how many patients I have that are on Crestor, 5 milligrams, not that many actually, but I use Crestor a lot. It's a brand name drug, and I only have to use like 5 milligrams 3 times a week. I don't have to use 40 milligrams every day to reach our goals because of everything else that we're doing with our patients. So family history is super important. Another huge red flag risk factor is if you have diabetes. Remember, I think we talked about this last week, where blood sugar actually is a pro-oxidation maker. So it's pro-inflammation. If you have high blood sugars, you're going to have a lot of inflammation in your body. And that unfortunately affects the lining of the artery to make more plaque. Okay. So family history, diabetes, and then I'll just go through a couple others. Tobacco use, obviously, if you're a smoker. Now, if you have a family history with a dad who smoked 4 packs a day, that might not be as important as if you had a family history with a dad who really took care of himself really well. So just keep that in the back of your mind. Sedentary lifestyle, cholesterol, you want to have an advanced lipid profile done. Most people that come see me do not have an advanced lipid profile, and so they don't know the breakdown of their cholesterol. They just know their total cholesterol, triglycerides, LDL, and HDL. But you want to have the fractionation of the total lipids and something called an ApoB. All of those are individual cardiac risk factors. So definitely you want to have that. High blood pressure. And listen to this, if you're a man who's age 45 or over, or if you're a woman age 55 or over and not on hormone replacement therapy. So hormone replacement therapy, when it's done properly, is cardioprotective. Obviously, obesity.
Yeah, that's interesting.
Yeah, obviously. Yeah, it's one of the reasons why I call menopause the 3 big things with menopause, the invisible killers: the heart disease, the brain fog and cognitive decline, and the bone disease that comes along with it, which is why my number one reason why I prescribe bioidentical hormone replacement therapy, because those are real killers, Brandon. This is what I see in my practice, and people wish they would have. When I'm doing their bone density and they're minus 35% in their bone density, they're like, well, I wish somebody would have told me. And I'm like, I wish somebody would have told you too. But I've been telling people this since 2000. I mean, for over 20 something years. And I did not listen. Now there's a bad study, the WHI study, that scared everyone from using hormones. The WHI study is a very bad study. And thank God there's some really smart doctors right now in Washington trying to reverse the recommendations that one study caused and wreaked a lot of havoc in women, because it really confused a lot of people that didn't know the actual science and data. So that obviously some inflammatory markers I always check on people, like homocysteine levels, MTHFR, and fibrinogen and other inflammatory markers. Those important things to do that everyone can do. So just to kind of reiterate, everyone should have an advanced lipid profile to include a total ApoB and something called an LP little a. If you just get if you ask your doctor for an advanced lipid profile from, Quest or LabCorp, they can order that for you. It's not a big deal. But, and then also, unfortunately, some doctors are like, no, you don't need that because your cholesterol looks normal. I would say a large number of my patients have, quote, normal looking cholesterol. But when we fractionate, that's when we see the problem. And that's when we see the cholesterol problem linked with the family history.
So definitely ask for that, even if the doctor pushes back.
Yeah. Mm-hmm. Unfortunately. And the reason why they push back, a lot of times they're like, they don't really know honestly, they don't know what to do with that data. So if you don't know what to do with the test, then why would you order it as a physician? And so, it's becoming more and more normal now, but 15 years ago, no one was ordering those tests. And so many patients would listen to a podcast and come see me and ask me because their doctor said, you don't need that, but you do need it. Everyone should have a baseline. The other thing you should have a really good assessment for is blood sugar regulation. Have an A1C done, have a fasting insulin done, and also obviously fasting blood sugar. And also, consider wearing continuous glucose monitor. Those are pretty amazing to see what and how.
Where do you get those?
There's some online that you can buy, but also your doctor could prescribe those. I personally prescribe them for anyone who wants it because I think it's great information.
How do they work?
They just attach to the back of your arm. I actually demonstrated that on a video on doctors being functional on my Instagram page, doctors, DOCTORS. So spell that out, being functional, Instagram. And I have a video on how to use it because so many people were trying to put it on and would mess it up. And it's like $75 every monitor. So you don't want to mess it up. Super easy don't freak yourself out with the needle. Some people look at the needle and they're like, oh my God, it's like you don't even feel it. Just trust me. And then it hooks up to your phone and you can monitor in real time.
Wow.
Blood sugar. So like you can eat the beets and then look at your phone and go, oh my gosh.
That sounds fun, actually.
It's so much fun. I'll send some to you.
Yeah, please
and then
do.
not only that, yeah, I will, definitely. And then not only that, but the other big thing is that you can be like, ooh, if I eat beets, but I eat them last, so I eat my proteins and my broccoli first, and then I'll eat the beets last. How does it affect my blood sugar? Because we know if you eat starchy foods last, it'll affect your blood sugar less.
Wow.
So,
all right, now
the other,
yeah,
no, go ahead.
Are you done with your list?
No, I have two other tests that I just want to make sure we talk about.
Okay.
That are very important. Okay. Obviously, some inflammatory markers I already mentioned, fibrinogen, homocysteine, CRP, things like that. So those are all normal. But there's a test called a CT coronary calcium score. That is a CT test. So it's a machine test. It's a 6-minute scan. Okay. It's about $150. You do need a prescription for it. Again, I don't know if your doctor is going to give you that or not, but you want to ask for it. The people that get a CT coronary calcium score test in my practice are the people who have 3 to 4 risk factors or more, because I want to see what we're dealing with. I want to see how aggressive I need to be treating this person, right? So a CT coronary calcium score, $150, cash pay, you go in, you're done in 6 minutes. It's about as much radiation as a chest x-ray. So really not too bad. There's a supplement like that glutathione that you sell that you can take before and right after the scan just to help with detox and reactive oxygen.
Is it like going to an MRI?
It's similar to that, yes. 6 minutes, that's all it is. And then you get this score, and the score tells you how much calcium buildup they see in the arteries. So if you have a 0 score, you're probably low risk, which is great. But if your score is really high, now we need to get more involved because we don't want you to be presenting with a heart attack because you're probably not going to make it. You know what I mean?
Yeah, well, that's really interesting you said that because one of my questions was going to be, hey, is there a scan I can do to see if my heart's in good shape? And yes, the answer is yes.
There's a lot of different scans, but that's an easy one, $150. Now, if you are high risk like my brother was, so again, we have a very extensive family history in my family, so I've had all these. So I know what I'm talking about, believe me, because I've done it, been there, done that. Tina's next on my list to do, by the way. So anyway, my brother, I'm like, he saw his cardiologist, had a stress test. It was negative, which stress tests are okay, but they're not great at detecting early disease, unfortunately. So he had a negative stress test, but I noticed that he was a little more tired than he normally is. He's normally like full of energy and doing everything and hiking with me and everything. And this time I went to San Diego and he didn't want to go hike. So I'm like, you're getting a CT angiogram. Okay. CT angiogram is a little more involved. That is where they actually have to inject a little dye in you and it lights up all the arteries. Okay. Now that test is $1,500. Okay. And if you don't have chest pain, pressure, shortness of breath, and your CT and your stress test is normal, insurance is not going to pay for it. But I'm like, I told my brother he has to get it done. I'm like, you have to do it. And it was positive. And he unfortunately had to have 2 stents put in.
You saved his life, doctor.
Yeah, and my sister Lamia is so far, but you know what? They still treat me like I'm the younger sister.
Oh, yeah.
Anyway,
what are you going to do?
listen, these are people I can talk about, Brandon. We have so many patient stories like this. I mean, on a monthly basis. My husband just had someone who had a CT coronary score of 762, and his cardiologist gave him a stress test and it was normal. And that guy came back to my husband, and my husband's like, you're getting a CT coronary angiogram. And he did. And he had a huge blockage in his widowmaker. This is not uncommon. 365,000 events. It's the number 1 killer in this country. And you have to be your number 1 advocate. Absolutely. That's why I love being on this show, because I hope everyone who listens to this, if we could be saving lives, that's what we're doing here. We're actually saving lives, and that's what gets me excited. So anyway, a CT calcium score, not a big deal, $150. And anyone who has multiple cardiac risk factors should get that. Obviously, if you have multiple cardiac risk factors and you're worried about all this, go see a cardiologist, a really good cardiologist, because they can walk you through all this. And now with the incorporation of AI into all of this, that CT coronary angiogram used to be thousands and thousands of dollars. $1,500 is not bad, and they're using AI to interpret it and interpret the probability of you having an event based on the thousands of other scans that the AI has already read and outcomes with them. So really, it's exploding, but we're still seeing 50% of people presenting with a heart attack. Why?
In other words, 50% of the people have signs they're about to have a heart attack, but they ignore the signs.
No, 50% of people don't even think they have signs. They just present with a heart attack.
Okay.
For example, I can walk into a room in the ER when I worked ER shifts. The nurse will say, Joe's a 62-year-old presenting with chest pain, and I'll walk in and evaluate him. 50% of people are presenting with a heart attack or some kind of cardiovascular event. They're not presenting with chest pain, pressure, shortness of breath, or all these other symptoms.
So they have no signs.
Right. So you have to assess your risk based on like my friend.
So 50% of people show signs in advance, 50% don't. Wow. Okay.
And that's not okay. Not in today's world, not with all the other things we can do for these people. That is not okay. Like my brother would have probably been dead by now.
Well, you saved his life. And he's your older brother, right?
Yeah, he's my older brother.
He better be treating you with a lot of respect. That's all I can say.
You would think.
Well, you need to let your older brother know that a lot of people in our audience think you walk on water. Even my big friend who's 6'5" and 300 and some odd pounds, hunter, fisherman, he's a rough redneck. He thinks Dr. Basima is amazing. So.
Oh, that's sweet. So what can we do about this, Brandon? Well, a couple things. Mediterranean diet is the best diet for prevention of cardiovascular disease. And basically, it just goes back to eating whole foods most of the time. We don't live in a little box. So if we're going to have a brownie every now and again, great. But make it a conscious decision to have something like that, not a everyday habit, right? So most of the time, you want to be eating a lot of vegetables, a little bit of fruit like berries, fish, and other poultries, and then also healthy fats, the olives, the avocado. I know we talked about the avocado last time. I told you to freeze it and put it in a smoothie. You won't even taste it, or make the avocado chocolate mousse. That's actually not too bad for you. And then of course the supplements that we have on myvitamin.com/worldview. Those supplements are amazing. All of them have the omega-3, the really super clean omega-3. It's super clean, and you know it is because you're not burping up a fish smell. It's also triple distilled, so it takes out all the fishy stuff and all the stuff that's bad in fish, like all the heavy metals and things like that, as much as possible. And, of course, we have prescription medications. Just know which one you need. Are you an overproducer of bad cholesterol or an overabsorber of bad cholesterol? You need to figure out which one of that, which group you belong to, and and sort of go in that direction. Antioxidants. We just created the antioxidant pack that will be featuring.
We're going to feature that next week, I hope.
We definitely are. It's already on. We're actually doing a whole bunch of new things. So yes, that's definitely there already. We just haven't fully released it. But really, that's what it all boils down to: exercise, sleep, the normal pillars of health.
Yep.
Diet, and certain supplements and things like that are really, really important. So.
And Doc, of course, we're on Worldview Tube, but our worldviewtube.com/health channel that this rolls onto as well, that's doing huge numbers. I mean, that's just 24 hours a day of interviews like this with you, Dr. Lana, Nick Helsher, the epidemiologist, Dr. James Thorpe, the OBGYN, Dr. Retta Moon. I think she's a pediatrician. I mean, all it is health interview. And that channel's doing huge numbers. I mean, who would have thought that a channel that's just sitting and talking with great minds about health would be so popular, and with people that are also not the typical audience I would expect, like Vic, who likes to hunt and fish and football. He just seems to love watching the health channel.
Everyone is worried about their health and wellness not because they're afraid of dying, but because while you're on this earth, you want to be functional.
That's
so
right.
What we are all about, the reason why we started myvitamin.com and the courses that we created and all of these things. And you know what, Brandon, we are booming. We are so busy. Our practice, we have such a long wait list, both my husband and I do. And people are paying out of pocket. They're not using their insurance with neither one of us because you can't get the care that you need with insurance, unfortunately. Now, you can have it for disaster reasons, of major surgeries and things like that, ER visits, things like that. But in terms of day to day, people are lining up to see us, and we feel so blessed with that. But this is why I also committed 5 hours a week to podcasts. And also I started a radio show. And
are we
the radio
carrying those? Are we carrying those?
Carrying what?
The podcast you're doing.
I'm doing podcasts with you guys. I have 5 different people that I do podcasts with every month.
I thought you're doing your own podcast or something.
I have a radio show. You can carry my radio show if you want to.
Yeah, we need to carry that, Logan.
Yeah, if you want to, I can give you the information.
Are you doing it on camera or just audio?
Just audio.
Let's add a camera to it and we can run it on the health channel.
Yeah, we can do that. I can do I interview people all the time.
Yeah, we should definitely be doing that. Logan, get with Dr. Basima on that, will you please? All right, Doc.
Yeah.
myvitamin.com/worldview. Please use that so we get credit, folks. It helps keep this network and all the free channels going. And we're doing 5 free channels now: our Bible Prophecy channel, our Bible channel, our health channel, our news channel, and our normal Worldview channel. I mean, all free. So we need to support and pay for it. These are great products you need anyway. Support your health and us at the same time. myvitamin.com/worldview. Say hi to Dr. Mike.
Mike? Yeah. You got it.
Almost said Mark,
right.
but Dr. Mike. All right. Thank you. Thank you.
Thanks.
We'll be right back after this break. Hello, I'm Brandon House. I want to thank you for all your support at wvwfoundation.com that helps make possible pushing out 24/7 content for free. Without your support, we'd have to put it all behind a paywall. But thanks to you and your support through our foundation, we're able to push it out for free as a broadcast service and broadcast ministry of WVW Foundation. Please consider going there and setting up an automatic monthly contribution, or go there and make an occasional contribution. If you prefer to support us through the mail, you'll find our mailing address there at wvwfoundation.com. You can also call and make your contribution over the phone by calling 901-825-0652. That's 901-825-0652. Again, all these details are available at wvwfoundation.com. Thank you for your support as we try to help people around the world understand the times through the lens of a Christian worldview.